Hey friends, I'm Stephanie Carter Kelly. I'm a physical therapist that uses yoga in just about everything that I do. Each week, I bring you physical, mental, and spiritual ways to heal your pain. This week, we're talking about the magic pill for shoulder pain. So this is for those of you that have mild pain, maybe with exercise or reaching overhead. Not for someone who really feels like they're stiff and they can't reach overhead because they've got some stiffness, they can't reach behind their back. But if you have that sort of pinching or catching sensation in the shoulder, maybe you had an injury or maybe you just feel like that pain came on for no reason, this is a magic pill for your shoulder. If you have a diagnosis of shoulder impingement, this also might work for shoulder impingement. So what you need in order to do this little bit of exercise, my Magic Pill series is all about having a small amount of exercise that you do each day to take that little dose of exercise, just as though you would take that dosage of a pill to see if you feel better. And if you do feel better, it's one indication that physical therapy, seeing a physical therapist might be the thing that you want to do. But this will get you started. This will get you started, and who knows, it might just fix it. So you need a belt or a loop that you can, a belt or a strap that you can make a loop into, and you're going to pull your elbows down by your sides and then put the strap on your forearm. So I'll show you the side position. So you just want your upper arms to be straight down to the floor. And you want to make sure the strap is on your forearms. You don't want it on the back of your hands. You want it on the forearms. Okay? So you can do this in sitting or standing, but you need to make sure you come to like a nice neutral position through the spine. If you do a few cat-cows and just find that neutral position, take your shoulder blades and take them down away from the ears. Neck is in a nice neutral position. So you want a good posture to start with when you're doing this activity. So again, you're keeping the elbows tucked into their sides and you're just gently pulling out into the strap. So your hands can stay exactly this way. I'm just going to take my thumbs and show you which direction we're going. So you're pulling out into the strap. So you're keeping some tension on that strap. Now, you are not pulling as hard as you possibly can. You are pulling just a little bit. If I were to tell you that you're pulling 0 is nothing and 10 is pulling as hard as you possibly can, I want you to pull about a 2. So you're pulling about a level 2. So as I'm kind of watching the video as I'm doing this, the thing that makes you know that you're doing it correctly is that you feel this right around sort of the cap of the shoulder. You don't want to feel it in the sides of your neck or in your upper traps. You just want to feel this gently in the shoulders, and you can just kind of keep holding this and breathe all the way into the belly, and then let the belly fall. Just take several breaths. See if you can hold this for 60 seconds. We're just trying to turn on the rotator cuff muscles so that they can work when they're supposed to. When you're reaching overhead or when you're, reaching outside of your body. We just want to make sure that these muscles are turning on like they're supposed to. If you had an injury to the shoulder, these muscles will shut down in a protective way. And so you have to bring them back. You have to remind them how it is that they're supposed to exercise. So I've been holding this for a while and I can feel the fatigue in each of my shoulders. And that's what you want to get to, whether that's 30 seconds, 60 seconds, 90 seconds, holding up to 2 minutes. You can hold that little bit of an isometric contraction for 2 to 3 minutes, but you want to do that every day. And you may want to do that twice a day. Again, you don't want to pull too hard. That's like an overdose. You don't want to have an overdose, pulling as hard as you possibly can and tightening up all the muscles of your neck. Pull just enough. Just enough effort is one of those lessons in yoga where you want to make sure that you're that you feel the effort, but you don't overdo it and you push too hard, that's when we get into injury. So having the awareness of how hard you want to push is very important in many of these magic pill dosages of exercise. You know, we titrate our medicine to make sure we have just enough medicine to get the effect that we want. And we want that the same thing in exercise. So if you like this video, or if you know somebody that has shoulder pain that might benefit from this video, share it with them. Subscribe to my channel. I'm just shy of 100 subscribers, which is sort of a trigger in YouTube to give me the ability to do other things on this channel. So subscribe to my YouTube channel, tap the bell so that each week you're alerted when I post a new video, usually on a Tuesday. I'm Stephanie Carter Kelly, yoga physical therapist. Namaste.